Hello and welcome to this video explaining why oxygen does not improve your feeling of shortness of breath. If I were to ask you if oxygen therapy improves the feeling of breathlessness, what would you say? If you had a hard time breathing, would you be asking for oxygen? If you answered yes to both questions, you would be answering as many people do, but this would be incorrect. Many people believe that when they feel short of breath, they must need more oxygen. This is true in rare instances when the lungs are not able to transfer enough oxygen into the blood. The main reason people feel short of breath is actually due to a buildup of carbon dioxide, CO2, and an inability to breathe it out. Do you know the oxygen concentration in the air around us? The air we breathe has 21% oxygen in it, which is what our lungs are able to safely work with. Anything above that can be damaging to our lungs over a long period of time. Have you ever stopped to think of how amazing the human body is? Imagine your body is a factory that produces energy in a process known as metabolism. Every factory consumes supplies and produces waste. Every cell in your body needs energy, your muscles, bones, organs, and skin. To make your body move, digest, talk, and think, every cell in your body consumes oxygen to produce energy. The waste from this reaction is carbon dioxide, CO2. Did you know that your brain is an incredible and complex organ that never stops processing information? Your brain continuously monitors the level of carbon dioxide in your blood. When the amount is too high, the most effective way to get rid of it is to breathe it out. So, as soon as your brain notices a higher level of carbon dioxide, it will make sure you breathe faster and deeper. The faster you breathe, the less time you have to breathe out and get rid of the extra carbon dioxide, which may result in feeling short of breath. Do you ever feel out of breath? Most breathlessness, especially with exercise, is caused by an inability to breathe the air out of your lungs. Oxygen enters into your lungs when you take a breath in, and carbon dioxide leaves your lungs when you breathe out. Two connected but different processes are happening every time you take a breath: oxygenation and ventilation. Ventilation is the air moving in and out of your lungs. Oxygenation is the amount of oxygen in your blood, not usually the cause of breathing difficulties. Are you feeling strong and healthy? When your body is healthy, it produces less waste gas, CO2, for the same amount of activity. If you have a serious illness, are weak, tired, or deconditioned, your body will produce more carbon dioxide. This will increase the amount of carbon dioxide you need to breathe out. When you have a chronic lung disease, especially chronic obstructive pulmonary disease or COPD, you will trap air in your lungs and will not be able to breathe out completely. As the name suggests, the obstructive means that you cannot breathe air out as easily as you used to. Do you ever struggle with breathing? The reason you might have difficulties breathing air out of your lungs is the damaged airways that are part of many lung diseases. A healthy airway keeps its diameter open when you breathe in and out. A damaged airway will collapse when you're trying to breathe out. Imagine trying to inflate a balloon. If you keep the neck of the balloon open, you can easily move air in and out of the balloon. The moment you occlude the opening after you push some air into the balloon, the air will be trapped in the balloon and the balloon will become bigger and bigger. Something very similar is happening in your lungs when you have a lung disease that affects your airways. When you take a breath in, your chest becomes larger and your airways and lungs expand and the air flows in. When you breathe out while your airways are not as healthy as they used to be, you push them closed, creating a one-way valve effect. This traps the air full of carbon dioxide in the lungs, not allowing the waste gas to be expelled. Does this make sense? It is mostly the inability to breathe out carbon dioxide that your body produced that causes you to feel breathless, not the amount of oxygen. If you have ever felt breathless, did you feel anxious or scared? That is very natural. Anxiety is another huge part of feeling breathless. Part of our survival instinct is to protect our airways and our ability to breathe. The moment we feel we cannot breathe, panic sets in. This is absolutely normal instinct shared by all humans. Is there anything that can be done to improve the feeling of breathlessness? Yes, there is. I will show you how to try to manage your breathing difficulties in a little while. But first, I want to explain more about oxygen. As I have already mentioned, oxygen is life. But if your body can get enough oxygen from room air, you should not take supplemental oxygen. You would not take pain medication if you were not in any pain. Long-term oxygen therapy has its own set of negative side effects. These are nosebleeds, dry nose and mouth, runny nose, and painful sores behind the ears from the oxygen tubing. Extra oxygen over a long period of time can actually damage your lungs. The oxygen equipment is also a serious fire and tripping hazard. Some people that need supplemental oxygen call the oxygen hose their leash. They feel very limited by their inability to move around or leave the house as they always have to calculate whether their oxygen tank will last them for the entire outing. Have any researchers looked into oxygen therapy? Yes, indeed they have. Many studies have looked into oxygen therapy, and they found that extra oxygen did not decrease the number of times people went into the hospital. It did not improve anxiety or depression. It did not decrease the rate of infection or shorten their hospital stays. It did not allow people to gain more energy or physical ability. It also did not improve quality of life for many patients. So, what can you do to manage your breathing? Oxygen does not help with breathlessness, but there are many things that do. Pursed lip breathing is a great way to keep your airways open when breathing out. This combats the reason why you're breathless, so it can really work. A handheld fan blowing close to your face is also very effective. It tricks your brain into thinking that there is enough air flowing by, so you do not have to be starving for it. The cooling sensation of the flowing air is calming. This is actually why some people feel less breathless when they are given oxygen via their nose in the hospital or in the ambulance. The flow of the oxygen also tricks their brain that there is enough air flowing by, so feeling breathless is not necessary. Slowing down or stopping, getting arm support, and leaning forward are all great ways to relieve difficulties breathing with exertion. Last but not least, a healthy lifestyle, including regular exercise, healthy eating, avoiding smoking and vaping, and proper sleep are all great ways to improve our factory, your body. Did you find this video helpful? I hope the answer is yes. Please see our next video explaining how to manage your breathing difficulties in more detail. There is a PDF pamphlet included in the comment section explaining most of the information provided in this video. Feel free to print it out and use it as a reference. Thank you for watching. Kindly fill in the post-video survey. The link is in the comment section. Your participation is greatly appreciated.